All right, Mike, you are live on Facebook and Zoom and can begin.
Well, thank you very much. I want to thank everyone for joining us today. Those of you who are on Zoom and those of you who are participating on the live stream on Facebook. And I want to thank our great panelists who are here today. You know, the last time that we got together to have a public event, a press event of this nature was when we were still working on the recovery bill. And I think I told you at the time, I repeated what the new administration has said, and that was that help is on the way. And now we've passed that bill, passed out of both houses. President has signed it into law, and there's a plan in place to provide the help that people so desperately need and deserve. So I guess we can kick it off today by saying that that help is actually here. So thank you for joining us. And I want to just briefly go over what the American Rescue Plan does, and I'll do the 30,000 feet version, and then we'll hear from our panelists, and we'll open it up for questions. First, it really works hard to put vaccines in people's arms, and that is so very much needed. There's over 12 billion, almost $13 billion for a national vaccination program. There's also money in this to increase testing and tracing and to get more personal protective equipment out and available to people. And that's already starting to pay off. Right now, the report is that we're doing about 2.5 to 3 million vaccinations per day. There were on the 59th day of this administration, there had been 100 million vaccines administered. And the president announced today that their new goal is 200 million by 100 days of this administration. So that's good news. Second, the bill puts money in people's pockets. That includes the $1,400 direct payment that people will receive, people making under $75,000 a year, or couples under $150,000 a year. It extends the unemployment program. It subsidizes COBRA insurance to make sure that anyone who lost their health insurance because they lost their job will have health coverage during this period. There's over $20 billion for rental assistance to help keep people in their homes. And through the tax provisions in this bill, the earned income tax credit will be tripled, and the child tax credit will be expanded to $3,000 per child. And a side note is that all of the economists in the country tell us that these provisions will cut in half childhood poverty. So if you're a public servant, such as the people that are on this panel, or you're a business person like Frankie, who's on the panel, who does double duty as public servant and a business person, we should all have the same goal. We should all be working overtime to make sure that kids have the same opportunities that all of us had. And this goes a great length in making sure that happens. Third, the bill will help put kids back in school safely. There's about $130 billion for funding school reopenings and to make sure that kids who lost traction during the distance learning have opportunities to gain that back through things such as summer school. And then fourth, the bill puts people back in their jobs, and it helps to ensure that we have essential services. And that means everything from economic injury disaster loans to a carve out for restaurants. They suffered disproportionately during this pandemic, and restaurants employ a lot of people, a lot of single moms, who need that money, and folks who don't have other job opportunities. There's also a carve out for any of these public venues that have been shut down. And every one of our communities has these. If it's a public event, if it's a concert, if it's a bicycle ride or a marathon run, the businesses that put those on have been put out of business. So this will help them. And a very important feature in this bill is it provides funding to state and local governments. And that's critically important because state and local governments were on the tip of the spear in fighting COVID and responding to both the healthcare side and the economic side. And state and local governments can't borrow money. So if they don't have the revenues that they need to continue, they have to lay people off. And if that happens, that means more people on unemployment, more tax dollars going to help people who are on unemployment, and less money in people's pockets to spend in our local businesses and our local restaurants, which hurts us all. And most important, these are the people that we need to be employed during a pandemic. These are teachers, healthcare providers, first responders, and all the folks that deliver essential services to all the people throughout our district. So that was a crucial part of this piece of legislation. So that's kind of the 30,000 foot version. And now what I'd like to do is call on the folks who have joined us today and who can tell you firsthand how the American Rescue Plan is helping our district at the very grassroots level. So thank you all for joining us. And I'll start by introducing Dr. Gary Pace, the Lake County Public Health Officer.
Hi, thank you, Congressman. So I'm sharing my perspective as the Public Health Officer of Lake County, and I'm someone who's really spent the whole last year completely focused on COVID. And this bill really gives a lot of hope that we're finally going to be able to move on to a life that's really not driven by the fear of the virus and all the suffering that it causes. So, you know, the most exciting part of this, Congressman mentioned the different things about $12.7 billion and where it's going to go. But I think the most exciting part and the part that's most impactful at this point is the vaccine distribution and improving that and the rollout in California. So just to give an example of what it's like in Lake County right now, but really this is true in all the counties in the area, is that we've been on an all hands on deck approach here for the last many months. And all of our staff and resources are going into getting the vaccine out to everybody. Now, at this point, over a third of all the people 16 and older have gotten at least one dose. And in the older folks, the 75 and older, it's 2/3 of all those people, and everybody in the nursing home, all the nursing home residents. So just to give an example of what the future could look like, is that in the nursing home, since those folks have gotten vaccinated, we've not had a single case in the nursing home. And those places were a disaster in the fall. You know, people were dying, people were locked down in their rooms, and now they're, with no cases, they're starting to be able to get out and get some activities and have some visits with their family. And it's really starting to look like more normal life. So what this means, I think, for us is that as we get the vaccine out in the community and we get more and more people vaccinated, we're still going to see some surges, but the death and the severe illness and the hospitalizations are just not going to happen the same way because the most vulnerable people are protected. And the more people we get covered, the more we're going to be able to get back to normal and the less suffering there's going to be. So what this bill does is puts a lot of money in to helping us get the vaccine out to people and to get it where it needs to be the most. And so it's going to help with staffing and supplies and all that kind of stuff. But it's also going to help with communication, helping people figure out where they can get appointments and how to register and all that, because it's not easy and it's been changing all the time. And I think also another huge part is going to be helping us educate folks so that the vaccine hesitancy will not be nearly as much and we can get more and more of the population covered. So, you know, basically, I really believe that we're through the worst of the pandemic now, but it's not over. And, people are going to start loosening up and getting more lax, and it's going to be a problem. And really the best tool we have at this point are these vaccines. And the sooner we get them into people's arms, the sooner we're going to be getting back to normal, more normal lifestyle, more normal activities this summer, the kids back in the schools and everything that goes along with that. So I really think the support this bill provides will move us along a lot more quickly. And we're really grateful for the leadership from Congressman Thompson at the national level. So thank you.
Thank you, Dr. Pace. Next, I'd like to introduce Frankie Limos, who is the owner of a fantastic restaurant in Roanoke Park.
Hi, everyone. Thanks for having me here today. So my name is Frankie Lemus. I'm the owner of Taqueria Solesteca. We've been providing food for Sonoma County for 29 years. Next month will be 29 years. I guess today I represent the food service in our industry. We're the industry that got hit probably the hardest in most areas. As you could tell, there's a lot of businesses that didn't continue on, had to close doors. So when you're an owner and you operate for so many years, most owners that have been open that long have employees that have been with you 20 years, 15 years, and then to have to turn to them and ask them or cut hours, cut days, it's hard to do. So today, what I'm going to talk about, what I want to share with you guys is how the PPP really helped us out and helped our family out and helped everybody that I employ, right? We have to worry about staffing, the employees' rent, product supplies, and of course, taxes and stuff like that. So, last April when this pandemic first hit, I didn't know what I was going to do. I was trying to hide my emotions, but it's hard to do. And it was just dead. So when this PPP came out in March, I jumped on it. It helped me out tremendously. It helped me get through most of the pandemic. And then when I found out later for the second round, in December that there was going to be another round, it really put me in a great position. So I was able to carry on and operate normally. And when I started to do so, I turned it around with a nonprofit that we co-founded here in Roanoke Park, the Latino Alliance. We turned around, we helped other businesses out, and it really became a community thing. And the PPP has done great things for our community. I'm sure other communities. But it's a great feeling to know that help is here and it's available. So thank you.
Thank you, Frankie. Next, I'd like to introduce Tina Rivera from the Sonoma County Health Department.
Hi, thank you so much. So glad to be here today. I just want to share that this bill, I believe, has positioned health departments across the country even in developing a robust response to this pandemic, especially in relation to the vaccine rollout, getting shots in arms, and also communication and outreach. And because of the disproportionate impacts of COVID-19 in our communities of color, Sonoma County, we've adopted a mission, vision, and value statement with respect to rolling out our vaccine program. Our mission, of course, is to support and promote the equitable administration of COVID-19 vaccine across Sonoma County. And with respect to the values that we've been rolling this out, it's been about equity and community engagement, which this bill has really helped us to promote healthcare partnerships and access to vaccine centers, information transparency, and vaccine safety. And just to share with you, I just want to brag about some of the key milestones that we've been able to hit in Sonoma County. We've surpassed 250,000 vaccine doses administered. This means for us that 23% of our population 16 years old and older have had both doses, first and second doses. And this also means that 41% of our population has at least had their first dose. So we're really proud of that, and we're really thankful for the assistance that this bill has provided in order to do that. And we're expecting to be able to ramp that up with continued assistance. This bill has provided funding for communication and outreach. We've been working with Leap Solutions, and we'll be able to ramp this up. And we've been holding weekly stakeholder engagement meetings and addressing vaccine hesitancy, barriers, access to vaccine. We've been focusing on equity activities because of those disproportionate impacts that I mentioned. We've been having regular meetings, and we'll continue this and be able to, with this assistance, with organizations such as our Latinx Health Work Group. We've been informing these groups and getting feedback about our planning activities. We've done a lot of work in our vaccination centers. We have about 12 throughout Sonoma County. We've been able to work with our interpreters, our language people call line. We've been updating our signage. We'll be able to continue to do this. We have resource tables throughout our vac centers. They're staffed by our Latinx community-based organizations. We've been working closely with our FQHCs to communicate where those disparities are throughout our communities and focusing our efforts on these particular individuals. And I also just want to take a minute and recognize and acknowledge the 308 lives that were lost to this pandemic in Sonoma County, and just shout out my support and prayers to those individuals and those families. And also give a shout out to our health teams, because it takes a village, and we've been able to work with our local healthcare partners, our FQHCs, our community-based organizations, a host of volunteers, our stakeholder groups. And if there's anything that this pandemic has reminded us of, and we're so thankful, for this support, and Representative Thompson for your advocacy. If this pandemic has reminded any of us that life is precious, and that building these connections and building bridges is really more important than ever. So thank you for allowing me to share.
Tina, thank you very much. Next, I'd like to introduce Solano County Supervisor Monica Brown. You've got to unmute.
Yeah, you would think I would know. I do this like 4 times a day. Thank you, Congressman. The American Rescue Plan will help the cities and counties because we're going to have a longer time to plan. The deadline to spend the money is December 31st, 2024, and the money comes in 2 tranches. And the first one is due by May 10th. So we'll get 50% at May 10th. Well, what is it going to do for the cities and counties? We're going to have an increase of Medicaid funding for the pandemic funds for CalWorks. We're going to have additional funding for elder justice and adult protective services, help for substantial abuse and mental health services, emergency rental assistance, help the homeowners pay for their mortgage payments. We're going to extend the 15% increase for CalFresh benefits for 3 more months. We're going to have money to expand our county services that spent many hours processing the applications for food assistance. We're going to have money to help families most in need to pay for their energy and water utility bills. We're going to have money to pay for administering the vaccines and other COVID-related activities. Our libraries have helped with hotspots given to students and other family members. This money will allow the libraries to continue the service and buy more hotspots, because this pandemic has pointed out the lack of technology for many of our constituents. And this is just a shout out to you, Mike, is that Solano County is not receiving its fair share of vaccines. And we really would appreciate your help in that endeavor. And we sent you a letter whenever you get a chance to get it from Mel. But I'm going to share with you the fact that we're going to have this money cannot come at a better time. I'm so afraid with evictions. So thank you very much.
Thank you. Next, Napa Mayor Scott Sedgley.
Thank you, Congressman Thompson. Yeah, this Supervisor Brown said, boy, that this is just great news for small cities. The trees are blooming and the skies are blue. And with this news for our little city, it's going to make all the difference in the world. We had to reduce services that we deliver, and that's what, after all, cities do. We provide services, all kinds of services. Our parks department, we reorganized our parks department because of staffing and funding issues. We're still providing that maintenance of our parks, because now that our citizens, our parks are being heavily used. People want to get out; they're just ready to go. And so, this American Rescue Plan funding is coming through at just the best time. We're down 80 positions in our small city. We haven't filled 80 positions through attrition and vacancy. That's about 16% of our entire workforce. And so that slows everything up on the processing side, but we were able to deliver public safety. We've dipped into our reserves. Fortunately, when we went into this thing, we were in good fiscal shape, so we had reserves to go to. This will help stop the bleeding as we extract out of those reserves. It's that bridge money. So for the city of Napa to receive, over $14 million into our little budget is huge. We have about a $30 million projected deficit in revenue, but this is really going to make the difference to get us across the finish line. I can't thank you too much for what you do in Washington for us. We depend on our legislators like Mike Thompson to be an advocate for us. I understand you sent a letter to Treasury Secretary Yellen expressing your wishes that money come to our cities directly, like larger cities and counties. We cannot wait for that funding. We have been treading water, but this is the light at the end of the tunnel, and it's going to make all the difference in the world for Napa. Thank you so much for what you do.
Thank you, Mayor. Next, I'd like to introduce Martinez Unified School District Superintendent, Dr. Julie Sinyard.
Thank you, Congressman Thompson. Thank you for allowing me to have this opportunity to thank everyone. And I just want to kind of reiterate what Ms. Rivera just said. This is truly a team approach. And I thank you for all your work to help school districts and help get our children back in the classroom. This has been an extremely challenging year, and we've just reopened. We brought our elementary students back on the 11th of March, and it's reviving my soul. It is so wonderful to see kids here. Again, I thank Contra Costa County, and they have been so helpful for us to help with vaccines, getting our teachers and our staff vaccinated. It's been amazing. And so thank everybody for helping us bring our students back to school where they need to be. And again, this money is incredible. The American Rescue Plan has really helped school districts, especially Martinez, kind of navigate the guidance and protocols that have been set forth by state and local guidance. So this hasn't been easy to try and adjust and make sure all the personal protective equipment, ventilation is, I know more about MERV 13 filters than I ever thought I would know in my entire life. So great, it's so helpful, but our kids are safe, our staff are safe, and we have the appropriate classrooms and classroom setups to ensure that we can mitigate any kind of spread of COVID-19. We are confident in that. This funding will help us address several areas of need, including any potential learning loss. I mean, folks worked so hard during distance learning, and the pivoting the educational delivery system, unbelievable, the effort that teachers and staff created to make sure our students are still learning. I thank all of them, but we all know kids need to be in the classroom. And again, having the appropriate funding to do this, advanced notice that we know we can have summer school. We're not just doing credit recovery. We can have extension. We can have targeted intervention. We can do enrichment, and that's huge. Again, kind of working to bring our students back in session. Our secondary students start on Monday, and again, just thrilled, couldn't be happier enough about that. But I know families are still nervous. There are still a number of families that are wanting to stay in distance learning, and with this funding, we can continue to reassure them schools are safe to open. Guidance has changed as well right now. We're back to a 3 feet distancing of social distancing, and we need to kind of work and wrap our brains around that right now. And so again, thank you for that. Again, with the improvement in ventilation systems, schools are safe to reopen, and we're happy to be doing that. Again, the additional funding will help us with a whole host of variety of additional supports for schools. We're looking at supporting mental health needs like we've never had before. We know it's going to be a challenge as we, bring our students back into the classroom. We know we're going to have academic interventions, and how do we prepare our staffs for that? So this increased funding, the increased safety measures that we're all school districts are implementing, I thank you so much for that and appreciate all the support.
Julie, thank you very much. Now we'll go to the Executive Director for the Up Valley Family Center, Jenny Ocon.
Thank you. I'm happy to be here this afternoon. As a community-based nonprofit, we've seen firsthand how the pandemic has truly been devastating for our local families. And the American Rescue Plan is something to celebrate. It's going to dramatically reduce the hardship that the families have faced over this past year, and help make a stronger, more equitable recovery. The plan has expanded and extended unemployment benefits, and we know that job losses have been the greatest in low-wage industries. For example, in our community, it's really impacted people who are working in restaurants and hospitality. The plan reinstates an increase in the federal unemployment benefits. It provides more weeks of benefits and expands eligibility for jobless workers. And this provides critically needed relief for families, particularly where one or both may have lost a job and haven't been able to find work or to return to work yet. The plan has also tripled the child tax credit, as Mike stated earlier, the congressman stated earlier, and that is the earned income tax credit. It's a game changer for our families. We see it every day through our volunteer income tax assistance program. As families file their taxes, they're getting more money in their pockets to pay for basic necessities that they have struggled desperately to afford over the past year. Specifically, the child tax credit, it increases that credit for families with children up to $3,000 per child, or up to $3,600 per child if they're under age 6. And it extends the credit to 17-year-olds. The expansion lifts 4.1 million children above the poverty line, and it is a huge impact and something so desperately needed. And I want to thank you, Congressman Thompson, for your advocacy in making this happen. While these credits go into effect in the 2021 tax year for the child tax credit, families may seek advance payment beginning in July. We've already been talking with families about this based on their 2020 tax filings. The plan also increases the earned income tax credit, and that's for low-wage workers with credits up to $1,500, and increases income eligibility for those credits. So it really does expand relief for large segments of our community. For local workers and families who faced desperate struggles to pay for rent, utilities, and food, essential needs that we all have, the American Rescue Plan is creating solid footing and tangible resources for an equitable recovery.
Jenny, thank you very much. Thanks to all of the panelists, not only for joining us today, but for the great work you do 24/7, 365. And now we can go to questions from the press.
Thank you, Mike. Members of the press can go ahead and click the raise hand button at the bottom of your screen. That's under the participants tab if you're on a desktop, and the more tab if you're on your phone. Please be sure to keep your hand up for as long as you have a question. If your question has been answered, or if after you get your question answered, please be sure to lower that hand. And you will get a message when your question is going to be answered that the host has unmuted you. We'll then announce you to ask your question live over audio. So let's go ahead and take a question first from Will Schmidt of the Press Democrat. Will?
Alex, can you hear me?
You're live.
All right. Thank you. Congressman Thompson, appreciate you making yourself available today and bringing all these officials together. Do you all have any information you can share specific to the district when it comes to, well, all the parts of this bill? For instance, how many folks in the district are eligible and receiving these stimulus checks? In terms of the local government money, can you be more specific as to, do you have better numbers as to how much each jurisdiction is receiving, when that money is coming, how the cities and counties can be available for it? Just really, if you all could help me narrow down, what does this mean specifically for people in Santa Rosa and the rest of this district?
Will, I can tell you how much money each county will be receiving as the part of the state and local funding. We can get that to you, and that'll be a combined number for the county and then the local governments within that county. The other number in regard to the breakdown of who would be eligible, I could do that deep dive for you. I'm sure that IRS would be able to break that down. I don't know how easy it will be for them to get. And quite honestly, right now, my big push is for them to get the checks out to people, get that money in their bank account so they can use that money to, to stay afloat. So I wouldn't want to distract from that, but I can see what I can get together, and I'll get it to you offline.
Well, thank you. I appreciate that. If I may, with this local aid, I know that cities like Santa Rosa, and I've heard from, other counties and cities on this call today that it's, something they're really counting on for their budgets. Are there any strings attached to this money? Are there any prohibitions on how it can be spent, whether to backfill revenue or to use emergency costs, like, paying OT for, important workers who've had to do a lot of work over the last year? Anything like that could limit how this money's used?
There are little strings attached to this. That was one of the points of debate during the bill. There are some folks that wanted to really constrain how state and locals could spend the money, and the bill ended up as written in a way that would provide as much latitude as possible for folks.
Okay, thank you. And I have one more, if I can. Are you aware of any issues specific to your district affecting the rollout of this? Either ways that it's going to benefit your district more than it might another part of the country, or perhaps another industry here that's more prevalent? Any special benefits to this district or unique challenges that this district faces with this rollout?
Nothing comes to mind. On the business side, every business is eligible for what any business in any other district would be eligible for. We may have more restaurants because we're a hospitality rich area, so we may get more there. I don't know how we stack up as far as open venues go, but I think we're probably we're probably similar to any other place, any other district across the country. We have people who are out of work. We have businesses that have been shuttered, some of which have been closed for good. We have people that need vaccines. We have kids that need to get back in school. So I think it's pretty, it's pretty evenly spread out. We're a district that is a little more expensive in which to live and operate than some of districts represented by my colleagues. So we may get treated a little differently there, but that seems to be par for the course in everything, where there's when formulas have never been historically favorable to high cost of living areas.
Thank you.
Do any of our other members of the press have a question? If you could go ahead and raise your hand in the raise hand section.
Maybe any of the panelists want to respond to any of Will's questions? Can you think of anything where you're going to benefit in your county or your city in ways that others may not?
Scott.
Oh, sorry, my bad. Go ahead, Mayor.
No, thank you. Sorry, just butted in there. But like was explained by you, Congressman, the no strings attached was very important to us as a city, because each city and jurisdiction, I think, has some more pressing needs. And so many of ours might not be identical to somewhere else. And so I think that flexibility is really going to help us. And we need to bring back some of the staff that we've had to not fill. And that's going to be our big priority, is so those services can continue at the high level of quality that we expect. And so I think that's so important to us. Thank you.
Thank you. Monica, do you have something?
It was just to say that I love the flexibility that we can determine on the local level with public input where to go. And right now it's making sure that
Monica's
People
frozen
are-
up. There you go. You're cutting in and out, Monica. I think your connections. Okay. Any other questions from the press?
Looks like Will Schmidt from the Press Democrat has another question.
Okay.
Will, go ahead.
I mean, if nobody else is going to, I'd love to. I guess just going off what the gentleman from Napa said, I think it was the supervisor from Solano as well. You mentioned that it came in 2 tranches, or it would be coming in 2 tranches. Do you have information about the timing of that money and, how it will be received? Is it as simple as you get a wire transfer from the IRS the same way, your constituents are getting from like in their stimulus checks, or what does that look like?
From the mayor of Napa, my understanding is that's not clearly been decided yet. And so, as I mentioned, Secretary Yellen's coaxing, we're trying to get those payments direct and not for the smaller cities and counties, not to funnel through the state treasury. So that's our hope, but we have not got that answered as of yet. I know the congressman is working on it.
Will, do you have another question? You're on a roll, man.
When does a city like Santa Rosa start receiving this money? Just could we be clear on that? That'd be great.
I'm not sure what status. I just got
Okay,
off of
okay.
Zoom with just about the entire city of Santa Rosa, the mayor, city manager, police chief, fire chief, and they didn't mention when the check, if the check had come, or whether or not it's in the mail. They were very appreciative that they have this funding coming in, and they were remarking on how much good they're going to be able to do for the people of Santa Rosa.
Well, I'll stop bothering you guys and I'll go bother them, but thank you.
Elizabeth, did you have a question? Elizabeth Larson from the Lake County News.
Yeah, hi. I just kind of following on what Will was asking. Are there any adjustments to the funding amounts that had previously been reported for the various cities and counties, or any of that being fine-tuned, or is that still about accurate?
I haven't seen anything new, just
Okay.
the numbers that I had originally shared with some of you.
And so it's still being decided when the money will come, and it's coming in two pieces, 50% up front and then another 50% later.
Correct.
Okay, thank you.
Great. Well, Mike, it appears we have no other questions at this time, so you can go ahead and close it out.
All right, sounds like the panel was very thorough, didn't leave a lot of room for questions. So thank you all very much for joining us today. And again, thank you for all the great work you do 24/7. And I look forward to seeing you in person soon. Stay safe.